Nurses Week, and today we're celebrating nursing and nurses with two professionals from the Center for Family Health. We welcome back family nurse practitioner Jacina Christensen and RN Clara Van Dusen. Welcome back.
Thanks for having us.
Happy Nurses Week.
Thank you.
Every week should be Nurses Week. You guys, awesome. We have so many great nurses. This community, our health and wellness certainly impacted greatly by your presence.
Thank you.
How did you decide that you wanted to get into healthcare and nursing, Jacina?
Oh gosh, I didn't really want to be a nurse at first, but something just told me, oh, I think I should be a nurse.
Really?
Yeah. So I started off in 2001 as an LPN. And just kind of thought, oh, this nursing thing is good. I need to do more. So went back to school again, and then went back to school again, and went back to school again, and here I am. So,
What is a family nurse practitioner?
so I went back to school to get my master's degree and have a certification to work as a family nurse practitioner. So I work along with a great physicians and other nurses just to provide care and well-being to patients. Seeing them, coming up with their plan of care, and working with them to just meet their goals.
I personally like it when I see a nurse practitioner because I feel like you know as much as the doctor, but you just have more time and you seem
Sometimes,
to
yeah.
it seems like you get more information. There's more interaction. A lot of times the doctor is really on a faster schedule. And you end up with more time with the patient.
Sometimes it works that way. I mean, we kind of work together. You know, I need my physician friends to help me when there's something I don't know, and they need my help sometimes to help them when they need some extra time. So we kind of work together just to get patients what they need.
And they'll talk to you. They open up more. They'll say, I didn't want to ask the doctor.
Yeah, sometimes.
Yeah. And you're a registered nurse.
Yes.
Why did you decide you wanted to become an RN?
Well, I started out as a nurse's aide with the elderly shortly out of high school. And then I kept thinking, well, I can do more. I can definitely do more. And so I went ahead and was going for my registered nurse. But the program, you need to take so many classes before you're accepted in the program. So then I took a detour and went for the LPN, which is a step lower. And then I thought, well, I'm that much closer to the RN. Might as well finish that. And then one of my longtime mentors encouraged me to keep going and keep going. So I did go finish my bachelor's in nursing. And I definitely enjoy helping people from all ages.
There's really a lot, in terms of, you mentioned the years and years of education.
Mm-hmm.
Back when I was in school, there were just LPNs and RNs, and that was it. There was nothing further, no other choices. What all are available now for people interested in nursing?
Well, gosh, there's
So much.
There's so much. There's lots of different things you can do. You know, there's LPNs, there's RNs, but we're all a team, so we have medical assistants, there's certified nurses aides, and lots of different people that can help take care of patients. You can get your bachelor's degree in nursing, your master's, your doctorate in nursing. So, yeah.
Yeah, BSN, MSN, it goes on and on and on.
So many avenues. I mean, you can go into more admin or you can go into teaching. So a variety of directions you can go.
And again, back in my day, there were mostly females that entered the nursing profession.
Mm-hmm.
That's changed too. But it's still the majority female. More and more men, though, are getting into it.
Yeah, lots of different people are coming into it, and just with the same goal of helping patients meet their needs.
So you went to Jackson High, and then what did you do after Jackson High?
Jackson Community College at the time, Jackson College now, and I got my bachelor's degree with Eastern Michigan and my master's degree with Spring Arbor University.
All close by.
Mm-hmm.
And for you, Clara, you went to Western High School, then what?
Then I went to Jackson Community College as well, and then I did get my bachelor's at Baker College.
So having Jackson College, Spring Arbor University, Baker, all with health and allied health careers, including nursing, how important is that for someone that is in high school now, considering a career, knowing that they can stay right here in their hometown?
Yeah, it was just helpful. I think it just fit into my lifestyle that everything was all right here. There's so many online options, which sometimes can be lonesome, but having everything that you need right close by and still meet your goals is good.
Very handy.
Very handy, and it's all about saving money too. You don't want to be in debt for a number of years because of school loans, because you had to move away, and you have school loans that you have to pay for eventually.
And now it's even easier because thanks to a number of very generous people and organizations, including the Glick family, there are now scholarships and other financial aid for people interested in health careers, including nursing.
Yes, because we need them. We need
Yeah,
them.
super cool. Now, as family nurse practitioner, you're working with all ages, all populations?
Well, actually, a lot of my background has been working with children and women and infants. So I actually work in the women's health department right now. That's when I was getting my RN and I left to get my master's degree. I left women's health, so when I came back to the center, they welcomed me back to women's health. So that's just kind of what I know. So that's where I'm at right now.
What do you like about working in women's health?
Oh gosh, there's pregnant women, there's women that just, they need that extra special ear. They need somebody to listen and need them to understand, and they already know how to take care of themselves, but they need information on how to do it maybe better, or things that can just benefit them in their health. So I just like being able to get to every age group, everybody in their developmental stage, and whether they're pregnant or not, and giving them the information they need and support that they need.
Claire, what area or population do you work with at the Center for Family Health?
Also in the women's health department. So we work in between the doctors and the nurse practitioners. We kind of scooch around in all different areas of the women's health department. Sometimes we're assisting with procedures, we're doing some care management, we're doing prenatal, gen care, so a variety of, and a lot of educating for the
In our
ladies.
community, that's one area and I think the center has spent a good deal of resources on improving outcomes for women and infants, and particularly maternal health. Are we doing better as a community in both prenatal, infant, and maternal health?
Yes, we are, and I think we're doing lots of different things to make everything better. We're starting centering pregnancy, group prenatal visits. We're going to start some training on that, so there'll be more information to come on that. Gosh, what else are we doing? Gosh, we just have lots of connection to resources. We've got our CHWs, our behavioral health specialists, and our drivers that help bring people to their appointments. So just trying to reach out to anybody that needs.
Yeah, something as simple as not having a way to get to a doctor appointment can have just a negative impact on their health.
Yeah.
And we've got a midwife too.
Yeah, we've got
We
our new
do.
midwife, and we've got another one starting, I believe, in July.
How does that work out? Is it someone that a mother to be wants to see, or do you make recommendations that this is probably the best path for you?
Some people just come in wanting that type of, the midwifery model care. So we're glad to be able to provide that option for them, but we still all just work as a team, our physicians, myself. I don't deliver at the hospital, but, I have my group of prenatal patients that like to see me as well, and, we have our midwife, and we all just work together as a team.
Center's undergoing a number of changes right now. We've got a construction project. We've got new drive-up, expansion of the pharmacy, and a bigger walk-in clinic. Where are we? What's the state of the projects right now?
Gosh, I haven't even
I
gone on
don't
that
know
side of the building. I don't know when it's anticipated to be finished. I guess we should have checked into that before we came, but we hear the construction. We know it's going well.
Last I heard, it was toward the end of this calendar year that they hope to be all finished.
Yeah.
But the Blackstone temporary clinic, every time I drive by, it's full of cars.
Yeah, it's busy. Yeah.
For you, as we observe and celebrate nurses, what is it about the job at the Center for Family Health for you, Tracina, that you find rewarding?
Oh gosh. The mission for the center is opening the door to healthcare for all. I was actually on the committee to help come up with that, but a long time ago, because I've been there so long. But that's just the goal, is to make sure that everybody has access to what they need. And that's the kind of care I want to be able to provide. And so the center and their mission kind of aligns with my personal, my professional mission, just to be able to provide and open the door to healthcare.
Wow, how cool. So you coined or helped coin opening the door to
Gosh, that
healthcare
was a
for all.
long time ago. We came up with this. We came up with the design, and a few other people that still work at the center. We were on a team to kind of come up with that. So yeah.
Do you get royalties?
No, I don't think so. But
How long have you been at
that's
the
okay.
center?
I started in 2001, fresh out of school as an LPN, and I left a couple times, but always came right back because this is just it's just
Awesome.
where I'm meant to be.
Claire, how long have you been?
2 years now.
Nice.
2 years.
What about this profession that you find most rewarding?
I just love to make sure, help the ladies from all ages to changing bodies, to get to know their body and not to be afraid to ask the questions. Because sometimes in growing up, you don't talk about some things that are really important as the body changes, from young teens to the elderly. The body does change, and to learn to take care of yourself.
That's a good point,
Yeah.
Clara.
Yeah.
I would guess women feel more comfortable talking with women health providers and same maybe with men.
They just like having a safe place, a
Mhm.
safe place to come where they know that they can be private and open and their privacy is respected. So some of our patients prefer our male providers,
Mhm.
just as long as
Yeah,
they
they
have
do.
that safe space to share
And you really get a chance to make a connection because you will see your patients
over and over. Yeah,
Mhm.
yeah. That's a great part.
Well, great. Thanks for representing all nurses
Thank
today
you
as we
for having
celebrate
us.
nursing. And thanks for all you do and everyone at the Center for Family Health does as we lead our community
To better health.
for more than 30 years.
Oh, there
There
you
we
go.
go.
Thanks for coming in.
Thanks for having us.
Thank you.
Family nurse practitioner Tracina Christensen and registered nurse Clara Van Dusen, both from the Center for Family Health.